Hello, Rachna. Welcome to the podcast, the Islam Unravelled podcast for the Muslim community of British Columbia. We really appreciate you joining us and taking your time out in your busy schedule to speak with us.
Thank you, brother. It's such a pleasure, and I think an honor for me to be on this platform and to talk to you.
Thank you again. And you also spoke at our event on January 29th, which went very well in our community. We've had about 30,000 views on all the different platforms.
Wonderful.
And we really appreciated you representing Premier Horgan and the provincial government to share your solidarity with our Muslim community.
Thank you so much. Anytime. It's an honor.
And can I call you, what would be the best way to, like I know with the protocol would...
No, just call me Rachna. That is fine.
Okay, thank you. So Rachna, with regards to your background, for those that aren't aware of your position in government or your background, maybe you could explain that you are, again, the Parliamentary Secretary for Anti-Racism issues in the province. Perhaps you could explain that role and the mandate and the work in this role that you have.
I would love to. Thank you for giving me this opportunity. I'm Rachna Singh. People who don't know me, MLA for Surrey Green Timbers, first got elected in 2017 and then re-elected in the last provincial election in October 2020. And with that, after that election, I'm extremely honored that Premier Horgan appointed me as the Parliamentary Secretary for Anti-Racism Initiatives. It's the first time that we have this role in British Columbia. And I would say that this role has emerged with, obviously, government's a strong stand against racism. It has emerged out of that, but also with all the advocacy work that community organizations like Islam Unravelled and other grassroots organizations that have been working for many years to create more awareness about this issue, about racism, about bigotry, about Islamophobia, about hate as such. And so really, really honored to be taking on this role. And with that, I would say that although I am the Parliamentary Secretary for Anti-Racism, but what I see in our government's mandate and under the leadership of Premier John Horgan, that he has made sure that every cabinet minister, every parliamentary secretary, every minister of state has this in their mandate letter, the anti-racism, to work towards anti-racism in their mandate letter. So it is not just coming from my portfolio, it is coming from, it is sector-wise, and it's a government's initiative. So a lot of work ahead of us in my role. I will talk about, we know how racism affects us, how it hinders us, how it blocks so many people to fully be representative or fully be part of the society, this beautiful province that we live in. And we know about the systemic racism that has existed for centuries. It is the colonial residue, and it is so imbibed in our system. But the global events of the last year, especially with the Black Lives Matter, with coronavirus and the rise in the hate crimes, all those things that they have brought the issue of racism on the forefront. And the issue that, like many people, the normal people, the average people, the media was not talking about before, but now they are. And it is good in that way, because now we are fighting with racism hands-on. And in my role, one very important thing that we plan to do is bringing in the anti-racism legislation. It would be the first time in the history of British Columbia that kind of legislation would be brought in. But along with that, we have many initiatives, and as we go forth, we will talk more about it. But one important issue that we are tackling is a collection of the race-based data. For a lot of people, this terminology sometimes is not an easy terminology. So I would try to break it down into easier language. When I talk about race-based data, right now, whenever we are collecting any kind of information, it does not talk about the race. It does not talk about the ethnicity. It is like it will talk about the gender. It will sometimes take obviously, a lot of times take your age, demographic, but not the race. It doesn't talk about the ethnicity. If you are for example, if you are a Muslim, if you are a Sikh, if you are an Asian, or are you Black? So that thing is missing in the data being collected in British Columbia at this time. And what we have noticed, and it has been brought forward by a number of community organizations, it has, especially with the COVID situation, it has been made very clear the gaps that lack of data is creating, because COVID, we know, affects all of us equally, but the effect of COVID is very disproportionate among the communities that are more marginalized, the communities that are more oppressed. Those can be indigenous communities, those can be Black communities, those can be communities that have more people of color in them. So that's why it is becoming very, very important. It has been everywhere I'm talking, every person I'm talking to, they are making it very clear about collection of that data. So that is one of the major tasks that as a parliamentary secretary I'm undertaking. We would be starting the consultations on that very soon with the stakeholder organizations, with the community organizations, to how to collect this data so that we can, after the collection of the data, it would be possible to bring in the policies to fill in those gaps, those barriers.
And that is very powerful, and thank you very much, and to the Premier Horgan with this vision of the team focused on this very important topic. Now, Rachna, your journey is an amazing one, coming from India and being active in societal issues there, and then coming to Canada and now being actually an elected member of government within a short period of time. It's very commendable and a great accomplishment, and it just speaks to your passion. And maybe if you could talk about how did you come into this passion for this work for community and helping people that are oppressed?
I would say a lot of times it's in your value system. It is how you are brought up, Brother Tariq. And the family that I came from was, although none of us were like in the political office, but we were very politically active, very politically aware society, family. And from my childhood, I remember talking about how even living in India, when we were seeing the disparities, we were seeing like that, how not everybody was equal. We know that in India, we have the caste system issue that was discussed very openly in my family. It was like how, not only the caste system, but also the classism, which is very prevalent. And I would say it would be same for for our neighboring country, Pakistan. So that is what I was hearing, and always hearing from my parents, especially my father, my grandfather, about working in a way that we are able to reduce that oppression, how we can be a strong ally. So that was taught to me very, very early on. And as I said, very politically aware family, we were always interested in like who's running for which kind of representatives we want, people like representatives who would think about people, would keep people first, rather than like the representatives who are just thinking about themselves. So that was made very clear. When I moved to Canada in 2001 with my young family, with my husband and my 2-year-old son, I brought that value system with me, that passion with me, but never thinking that I would ever get so active in politics. And I always say this about especially women and women of color, they never think themselves in this role. Even however active they have been, how much passion they have, they never actively think about this role. they don't see themselves in this role. And I was in the same situation. I became member of NDP very early on. I started volunteering with the political party, with different candidates, especially in the Surrey area, but never even then, never thinking myself in that role. So that when this opportunity came to me in 2017 for the 2017 election, I was taken by surprise. So for my first reaction was, no way, I cannot do this. So if it was not my family who had prompted me, who motivated me to take on this role, I would have declined it. So, but I'm really glad that there were like strong friends, strong family people who really pushed me towards it. And here I am. And I think I consider politics as a bigger platform. These were the things that what I'm doing now, I was always doing it. I was always speaking about the underprivileged. I was always trying to bring people up, whether those were, that was during my time with Canadian Union of Public Employees, when I was their national rep, or as a community activist. I was always talking about more equality, more just society. And but the politics, it definitely gives you a bigger platform. People know me more. My ideas reach out to bigger populations. So that way, I think I have been very, very privileged to have this opportunity in such a short time.
Absolutely, and also I saw that you also have worked in the space of alcohol and addiction and drug addiction, and you may be aware that the Muslim community, many stakeholders and many organizations have formed the Muslim Care Center with the Muslim Food Bank, and that is largely giving food on the downtown east side, just like the Sikh community also gives food on the downtown east side to the people that are in need. And this is the center of the opioid crisis. And part of what we did as a community was to also bring professionals that are counselors and peer support and addiction support people, and medical doctors that can help with methadone and Suboxone and other ways to help people off addiction, but also counselors and peer support just to speak with them and help with mental health issues. And it seems like obviously this is also a passion of yours, and people that are afflicted by racism, or as an example, Muslim women that wear hijab, as soon as they walk out the door, they are subject to a certain bias by some people. And same with people of color. As soon as we walk outside, people may perceive us in different ways. And because mental health is tied into, how society and how people feel that society is treating them, and mental health and addiction can be intertwined with racism. So please, let's talk about that work with addiction and the work that you've done in that space.
Yeah, no, very, very important topic, brother, especially now in the time that we are seeing that we are dealing with two crises, like it is the COVID crisis, but then like a very, on the similar lines, we have like opioid crisis, and we have seen so many people dying, and especially last year has been very, very tragic in that direction. Very sad.
And sorry to interrupt, more people died of opioid overdoses than the coronavirus in British Columbia.
Absolutely. And that is very heartbreaking. And also a lot of things attached with it, a lot of issues with it. A lot of times we think about, when we think about opioid crisis, we think about the downtown east side, or we think about like some places like where that is the area where that exists. Yes, definitely. And those people definitely need our help. But it is like our regular people who are dying of opioid crisis. Opioid crisis is a big, big issue in my community of Surrey, but we don't see it being talked about as openly as we will talk about COVID-19. And a lot of stigma still attached with it, with mental health as such. We talk about all of our, I know in our community, we are so good at talking about our health issues, whether it is diabetes, it is heart condition, it is anything to do with our physical health. But when it comes to the mental health, we always try to downplay it. Even with depression, like I remember when I was doing, when I had just done my master's in psychology, while back home in India, people would say, oh, what is the issue? I don't think it is just People just try to pretend that they are depressed. It is just like if they can just get out of it, not realizing that it is a real ailment. It is something very, very real that people are experiencing and not understanding their issue. And that still persists. Like 20 years on, I see the similar mentality still going in the South Asian populations, that they won't, if they have anybody affected by mental health, they will never talk about it. They will always try to hide it. And even worse with the addiction issues. There are a lot of resources, and with the but how to seek that resources, and that's why it's very important when you talk about racism. First of all, there is a stigma attached to it, but then also we need to have the culturally sensitive resources available as well. So what we have done, I would say that as a government, that we have taken this issue very seriously, appointing a minister just spearheading this issue, a ministry just assigned to this issue. That was something I think British Columbia is the only province that has a ministry, a standalone ministry just dedicated to mental health and addictions. So I think that says a lot about the government's commitment. But it is government will do its part. I say about a lot of things. I say that about racism also. That government will do their part, but it is like government won't be able to do it alone without the community help. And like the examples that you have given about the Muslim community coming together and finding out resources, helping the people, creating more awareness. This is what we need. And I know in our own South Asian community, overall, we have quite a few community organizations that are working towards it. And that's the kind of initiatives we need. More and more people talking about it, more and more people creating that kind of awareness, making it as like a general topic that can be discussed with no stigma, with no shame. And I'm really thankful what our Muslim brothers and sisters have done in this, and also the Punjabi community as a whole has come together to fight this. We still have a long way to go to deal with this issue, to fight this crisis. It's really sad, especially with the toxic drug supply that we have on the streets, and with the isolation that has come along because of the COVID. Earlier, people would do the intake in groups. Now they're doing it themselves, and that's why there are more people dying, because they're alone when they're doing it, the overdose, and nobody there to help them, nobody there to assist them. But this can be, I just want to really emphasize, this can be our brother, our sister, our father, mother, anybody. And we have to see it from that lens. If somebody we know is struggling, seek out help for them. Don't be, and there are so many resources in Vancouver, in Surrey area, in all the places that we have our communities, very strong representation of our communities. So please go out and seek out the resources.
Agreed. And what we did, like you said, it's taboo to bring up topics of mental health and drug addiction, alcohol addiction in religious and community ways. And as you know, with the churches, the synagogues, the temples, the mosques being closed, that social connection and that social community hasn't really been there for quite a long time, and people are feeling isolated. And before the pandemic, what we were doing was every month we were at a different mosque with actually, and I would call them heroes, Muslims who are former addicts, drug addicts and alcoholics, to tell their story. And as you know, it is a taboo subject, and most people don't want to admit that they had these problems. And when we would speak to them, I was like, are you okay being public about your problems with addiction? And they go, if we can just help one person to save them from going through what we went through, it's okay for us to put our face out there and our name out there, because we don't want people to go through what we did. And so we were in literally booked from every month at a different mosque to kind of really be engaging our community. And we had usually in community work, there's a lot of criticism for different things, but this specific issue, there wasn't criticism. I think everyone knew somebody, either a family member or a friend, that had drug or alcohol or mental mental health issues, and there's an overwhelming support. And so it does require, it's not just the government, it requires the community working together in multiple ways. And then we also brought professionals that were licensed counselors and addiction support youth workers to be there as a resource for those that wanted it. And then the other thing we started was the first 12-step program and Alcoholics Anonymous, Narcotics Anonymous program for the Muslim community. And that's been going on virtually now. And again, very great work. And a lot of our people in all these kind of addiction and mental health supports have worked with, again, the Punjabi Sikh community, the greater Christian community on all these initiatives. And so it takes a team, it takes a village, it takes all of us working together. And now this brings the next topic, like with the pandemic and obviously the vaccines and possibly opening the places of worship. Where are we at with the government for the next possible steps?
As you know, what the Premier has said and what the Health Minister has said, that every British Columbian who wants a vaccine will get the vaccine. And it is just like with the supply now becoming like easing up. And it will go into the community now, the vaccination. Right now it is done by the health authorities, but it will go out once the general population, it is the turn of the general population to be vaccinated, it will go to the community. And we will be looking at the community health, community resources to roll out that vaccine, because it's going to be a major project. So taking the help, as you talked about the opioid crisis, all the communities coming together and fighting it. Same with the vaccination rollout. And I think we as a community will have to come together. We'll have to open up our spaces, whether it is our gurdwaras, our mandirs, our masjids, our community centers, our non-profit organizations, any places, because it won't be feasible for the health authorities to do this rollout, to do the vaccination thing. And I remember coming from India, and we used to have this strong drives, the polio drives, going and from the small communities to the large communities, and every place I remember, whether those were our schools, those were our gurdwaras, our religious institutions, were opened up to do that campaign. And I am seeing the similar. I see a lot of similarity between these two, and that's what we will need, all the community help. First of all, creating the awareness that this vaccination, that anybody, I encourage people to go for the vaccination, because we have seen the results, that the people who have already been vaccinated, how it has increased their immunity. And so first of all, creating that awareness that this vaccination process, this is for their benefit, people should be encouraged to do it. And then also, when the rollout is happening, creating those spaces, whatever it can be, whether it is gurdwaras, mandirs, as a masjid, as I said, opening up those places to make it more easier, more faster, because everybody wants to live a normal life here in, not just here in British Columbia, but all over the world. So sooner we do the vaccination, the more immunity that we create in our communities, it brings us one step closer to the life that we are striving for.
Agreed. And the Premier did have a forum where faith-based leaders and community leaders were consulted on these teleconference calls that was moderated by members of the provincial government. And that was much appreciated. They wanted everyone's input, concerns, worries, and input. And it was in the calls that I attended, the Christian community, Jewish community, Black community, it was very comprehensive. So I will say the Premier really wanted layered consultation with the community to really get the strategy for vaccinations in the right manner. Now, in terms of possible openings for the places of worship, I know with the pandemic, do we have any possible timetables, or is it just dependent on, how the metrics of the coronavirus infections and fatalities? What are the targets or plans possibly from a provincial level to possibly see places of worship open again?
One thing I would really like to mention here, Brother Tariq, is that how the community has supported, how they have cooperated when the provincial orders came from a provincial health officer about closing these places or limiting the number of people who can visit. How the community cooperated, I'm just amazed by that, and I've seen it in my community of Surrey, where we have such a diverse population. Who for a lot of them, these places of worship are not just like for the worship. It is like more like their community centered, more like a place where they could get that social interaction, like a place of refuge for a lot of people. But how all these organizations came together to help the province in combating COVID. Like they came up with very, very innovative ideas. And so I'm really, from the bottom of my heart, I would really like to thank all of them. And as we are looking, everything that we have done here, COVID related, is science-based. Like we are looking at our data, and according to that we have made any decisions. And they are not political decisions, they are decisions based on science. And that's why it's always our provincial health officer, Bonnie Henry, taking the lead in this, and the province following her orders. So I'm really hoping, like with especially in the recent days, the numbers, the decline in numbers, that's a very, very positive sign. And I did hear from Dr. Henry a few weeks ago that if the numbers remain the way they are, like if they keep on going down the way they are going now, there's a big possibility of opening up, relaxing some of the measures in the religious organizations. So those would be the first step towards opening up, rather than, we know that one thing is very clear, that this is most of the cases are coming from the social interactions. So they will, even when they open up, there would be some restrictions, but there's a very high possibility of some kind of religious gatherings to happen, but with the COVID guidelines.
Thank you, and hopefully we'll know sooner. I think with the vaccine rolling out and infections going down, hopefully it'll be sooner than later. Now, another matter that's community related in terms of what's happening in India with the farmers and what have you. Maybe for those that aren't aware of this important issue, maybe you could explain what is happening and the protests that are happening in Surrey. If you could maybe describe what the issue is and the protests and just to elaborate for our listeners that this important area of concern.
Yeah, a really concerning issue for the diaspora, the Punjabi diaspora here in British Columbia. I won't get into the details of the bills that were passed because I'm not an expert on that. But there were 3 farm bills that were brought up by the Indian government, and they were passed in the parliament, in the Indian parliament. And those bills, broadly speaking, I don't know the nitty-gritty of it, but broadly speaking, are talking about the minimum protection that was awarded to the farmers in India. The bills somehow is taking that away, and a lot of concern about it, and a lot of concern, especially within the farming community. And as we know, you would have the same experience in Pakistan as well, that the agriculture is the backbone of Indian economy. And so once those bills were, as soon as they were passed, there was opposition started happening. Since November of 2020, the farmers have been protesting near the capital, the Indian capital, and thousands in the and November is we know is one of the coldest months. November, December, January, coldest months in India. Braving the weather, braving all the I would say all the odds these people are, these farming community is protesting, and that includes our older, our elders, our brothers, a lot of women representation there, a lot of youth. I would say this is in my recollection ever, I have never seen a protest so large, protest so big, a protest that has gone on for so long. I've never seen in my I was born in India, raised in India, and in all my time there, I've never seen something like this. And so this has taken, obviously, with the diaspora here in British Columbia, a lot of connections with that community. A lot of their family members are sitting in the front lines. So a lot of concerns raising out of it. And we see the representation here every day. Every day there are groups of protesters here in Surrey. They are in Vancouver, standing and making more about talking about awareness and asking for a peaceful resolution. So there are a lot of concerns that and especially with the images that we have seen in the recent days coming out of India, it is concerning, not for, I can say for my constituents, but for myself too. It pains me to see these protests going on for so long. But what we, I would say the provincial government, usually it is not their jurisdiction to talk about international issues, but Premier Horgan has taken a very, very strong stand on this because he has heard from so many of us. So many of the MLAs have gone and talked to Premier Horgan about the concerns that MLAs are hearing from their constituents. So according to listening to all of us, he has written a very strong letter to the Prime Minister Justin Trudeau to put some, talk to his, asking Justin Trudeau to talk to the international allies doing this intervention, because it is a federal jurisdiction. So asking them to do it and hoping for a peaceful resolution to this situation.
Yes, agreed. And it goes to even your background with labor unions and really standing up for people's rights, like human rights. And maybe please talk about that. You're because you have a lot of background and track record in that space, lobbying for workers' rights and human rights.
That is, as I said, like that is, it just comes, I don't know how it came, but I've always stood up for workers or for people who were oppressed. We talked about in the beginning as well. And in my role as a trade unionist, that's what I used to do the grievances for the workers, but also like just fighting for their rights. We know that in this age and time, the workers are still exploited. In Canada, we have like a lot of protections, especially when not just protections through the labor code for even the organizations that don't have the protection of the union. The government protections are there. The labor force protections are still there. But I have always, what I feel is a lot of people can speak for themselves, but there are a lot of people, brother, who don't have the capacity, who don't have the resources, who don't have the voice to speak for themselves. And I always think that those are the people who always need the help. I have spoken about the human rights situation in different countries, and I've talked a lot about Islamophobia, and a lot of times people ask me, like, Rachna, why do you talk about Islamophobia? You are not a Muslim yourself. And I would say that you don't have to be a Muslim to talk about an issue that is a human rights issue. Human rights are human rights. And what I feel in today's age and time, it is the Islamophobia that has, like, I see the, especially since 9/11, how it has become such a, I would say, such a real face of bigotry all over, globally. It is not just, I would say, just in North America, or it is in the South Asian subcontinent. It's all over the world. The kind of fear that was created against Muslims after 9/11, and how an average Muslim has suffered because of that. Not having experienced it myself, but just looking at it. And you mentioned about the hijabi women and the oppression that they face. It is so many stories have come forward about that, like just how you are wearing a hijab and the oppression that you feel, and the kind of bigotry that you have to experience because of that, just what you are wearing, and just getting that right to wear that, like how you are judged just because you are wearing a certain clothing. And so for me, it is very important. I have always talked about the woman's right also, but then I also talk about the woman right to choose. If a woman wants to wear a hijab, she has every right to wear it. I have no, I don't want anybody telling me, Rachna, what you should wear. I don't expect anybody telling a woman wearing a hijab that she should not be wearing a hijab. Just because I think I'm not wearing it, it doesn't mean that she does not have the right. If she ever feels that she doesn't want to and she doesn't want to wear it, that's her choice. A lot of times what I've seen is that, especially as a Western society, we think that the Western society has the right to tell people, to make people more civilized. We don't. And the Western society does not have this, it shouldn't be their, I think, prerogative to go and tell the whole world what they should be doing, how they should be, what they should be wearing, what kind of ideas that they should be adopting. As a civil society, if there's something wrong within their system or within their culture, it is the society itself has to evolve and find out the solutions for that. They don't want this external interruptions or pressures from outside. And this is what I see Islamophobia as, like thinking that Muslim culture is different, that we can educate them. The similar kind of mentality, what they did with the indigenous populations, with the residential schools, that they can somehow tame them. They can they can tame them in their own way, or then taking their culture away. Nobody has that right. And the history has taught us that, but still we see that systemic discrimination that we see within our systems. That is the hangover, the colonial hangover that we still have, and it is imbibed in our systems. It is projecting in different ways, in different kind of bigotry that was not seen few years ago, but now we see in different ways. So standing up, and it is not just for my own community. I will stand up for farmers as I have stood up for my Muslim brothers and sisters. It does not mean that I'm a Punjabi and that's why I'm standing. It is not, you don't have to be Muslim to stand up against Islamophobia. You don't have to be indigenous to speak against indigenous racism that our indigenous brothers and sisters face every day, or being an ally in the Black Lives Matter. You just have to be an ally. That's it. You just have to be human. You just have to understand that pain. If you have that, I think, and that is that it is all about my work about anti-racism also, that it is not just the governments who will be doing this work. And it is all of us. If we have that allyship, we have that feeling of allyship, we have stood up for anybody, and we need to. We cannot be just bystanders. We cannot expect the governments to do everything. We as a community have to stand up for our brothers and sisters, for any injustice that we are seeing around us. And this is what I was taught from very early on. This is what I hope that my children have learned from me. This is what I am hoping that after this podcast, people do that reflection, not just standing for myself or not just standing for my own community, just standing for humanity.
And you are right, and especially when it comes to somebody's culture. So although I am Muslim, but my family's from Pakistan, but historically, hundreds of years ago, our family's from Halwara, which is near Amritsar, and we can trace hundreds and hundreds of years of history. So we share the same culture, but the religions may be different. And in one family, not everybody's beliefs are the same in terms of their political views or social views. And in a similar way, we know Muslim women it's their choice. No one can force anyone to do, if they want to follow that expression of faith, that's their choice, that's their decision. And nobody has the right to force anybody to do anything. And I think what the general public is not aware is that it's their choice of the women to do that as an expression of their faith and what they understand or believe about the faith. And I think in respect of everyone's faith, and just like in the Sikh community, to wear the beard and the turban and all the other requisites of the faith, it's the choice. It's the personal choice. Nobody's to do it for a lifetime. How can somebody be forced to do that for a lifetime? It's their belief, their choice, and nobody's forcing them.
Absolutely. And I really want to talk about like lot of preconceptions that people just assume that a woman who's wearing a hijab, she's not she does not have access to education. I've seen some highly educated women. I have friends who are physicians who wear hijab, and it is their choice, and they are very, very progressive women. They are their ideas. They are very empowered women. A lot of times we think that wearing hijab, it is somebody might have forced them to wear it, but it is like they are completely economically independent women, empowered women who have made this choice, and I think it is their choice. Same with me. If I'm wearing something, and it is by choice. And if I'm wearing my traditional outfits, I left India 20 years ago, but I still love to wear my traditional outfits. That doesn't make me less empowered. I still it is my cultural identity that I really want to preserve, and I have every right to do that, and so do every woman who wants to whatever they want to wear. And a few years ago, I remember there was a huge controversy about niqab here in Canada. And at that time also, I said the same thing. Niqab is how many women wear that? I don't think even 0.2% of the Canadian population wears that. But for me, or any political party to come and say that you cannot wear it, how right is that?
And now everyone now has to wear masks, and nobody's objecting to wearing masks. So it's almost like it's a kind of sophisticated racism to basically say, oh, it's not our values, but then when it comes to our health, oh, okay, everyone has to do it. It's by law. So you can see the injustice in certain ways of certain political rhetoric, but now, as this is Black History Month, and I wanted to thank you again for participating in a program tomorrow celebrating Black lives. So the Black Muslims, as well as the greater Black community of Canada, has a rich history of Canada. And in our event tomorrow, we have members that are Muslims, that aren't Muslims, that represent what it's like to be a Black person in Canada, which is very different, even though, there's 12 countries in Africa that are Muslim majority. So the experience of religious discrimination, but then discrimination based on your skin color, as soon as you walk out the door. And literally before we got on this call with you, one of the speakers was talking about, what he was going to discuss on the program tomorrow was discrimination in the workplace, because as Muslims, our holy day is Friday, the Jummah, and and it's mandatory to go and pray the Jummah prayer, and a lot of times Muslims face problems with employers to get that 30 minutes or 1 hour to go do the prayer at the mosque or the masjid and come back to work. And a lot of Muslims say, we'll give the extra time afterwards or before work, we'll make up whatever time. But a lot of times employers don't give the ability for the Muslims to actually take that time out and observe the prayer. And a lot of Muslims are afraid to even say it because they're afraid of possibly losing their job or losing that shift because they don't necessarily want to rock the boat. And so that is another issue that he will bring up on tomorrow's discussion. But because this is Black History Month and the Black community, again, a very important part of Canadian society, with the province's work, with your work for the Black community, maybe we can just talk about some of the community initiatives specifically for the Black community that the province is working towards.
No, I think a very, very important topic, and I'm glad you bring up. And you also brought about the intersectionality about the Black people who are Muslims. So they are like oppression, but like it is more oppression happening. So that's where the intersectionality, that being a Muslim these days is how oppressed the Muslim communities are, the kind of oppression they are facing, and the Blacks, the oppression they have faced for centuries. And so when that oppression combines, the kind of trajectory it creates. So very, very important topic to discuss. Really looking forward to the event tomorrow. But Black, what we have seen, like a lot of times when we talk about the Black communities, we just think south of the border and all the issues related with the Black population, the oppression, the marginalization. We just think that that's where that happens. It does not happen in Canada. Definitely, we have a much smaller population of Black community, smaller representation of that community here in Canada. So that's why those numbers don't come out in open. But we have seen, as we have talked about, the anti-Indigenous racism, anti-Black racism is very, very prevalent, and just like anti-Muslim racism. And so it is very important to talk about the oppression that this community is going. So Black History Month is definitely to reflect on that. Definitely a time to recognize the contributions that the Black community has made, not just in British Columbia, all over Canada, but also to recognize the barriers that this community is facing, just even in this day, age, and time. As I mentioned, like how the whole global scenario changed with the movements that we saw last year after the murder of George Floyd and how the emergence of the Black Lives Matter. The whole movement, I think it has changed the lens. It has just changed how people were seeing racism, how they were seeing bigotry. It just created a new lens. Racism always existed, but how it brought the racism to the forefront. So I really, really appreciate this grassroots movement for bringing that awareness. And but the work does not stop just with the Black History Month, recognizing 1 month. It is like efforts that we need to do. Black History Month, we recognize the province proclaims, but much more needs to be done. And that's why in my role, I will be sitting with these communities, with these organizations, looking at the barriers they are facing, whether it is with the opioid crisis, it is the barrier with the housing crisis, it might be the barriers like the over-policing that we are seeing of the Black populations. So all these things have to be taken into the context, like how as a system, how we can bring the changes in the system. We are at this time reviewing the Police Act. I sit on the committee that is reviewing, doing that review of the Police Act. And that thing is coming out a lot about the over-policing of our Indigenous and the Black populations. So would be hearing from a lot of stakeholders about the barriers there, what needs to be done. And I'm there to listen. And I'm what I can say is, after not just listening to them, but also bringing in the changes, whether those can be the legislative changes or at the community level changes that we need to bring to break that cycle of systemic discrimination that this community has faced for far too long.
Agreed. And I know we only have a few more minutes before we wrap up. And the last item, Mary-Ellen Trupont and the report that she did about Indigenous racism in the healthcare setting in hospitals and certain assumptions and even employees that are of First Nations descent, the type of discrimination that they face, and perhaps obviously our First Nations brothers and sisters to talk about that and how the province can work to address this specific issue as well.
A really sad report, and but also an eye-opener for all of us, and also very happy that the province is taking a very strong stand about it, like doing the inquiry into it, like finding out like what can be done to resolve, break those barriers. But this is, when that report came out, it just, as I said, it was an eye-opener, but it has opened us to like many, has made us aware of the issues that we thought that the organizations that would be equal for everybody, but it is not. And that's why when I was talking about the COVID situation and how it has disproportionately affected certain communities, that also brings it to forefront that it is very important at this point to collect the race-based data, because right now we have this report because we were collecting the indigenous data, but we don't have like any information about other communities being disproportionately affected by this racism within our healthcare sector or within other institutions. So that is, when these reports come, they are very disheartening, but they are also an opportunity to bring in the policy changes that are required. So I'm really hoping for the change that is going to come with that, the leadership that Minister Dix is taking on this with this report, and they have already started the process how to resolve this, but also that this is just a little part of, we haven't seen the full picture yet. There's still a lot unsaid. There's many communities that have that are still facing that racism that has not come out in the open. So it's very important to take that out also. And hopefully in the coming months, when we have the capacity to collect that data, we'll have more information about like how other communities are marginalized or oppressed and what kind of policy work needs to be done to resolve and break those barriers.
Well, thank you for explaining that. And we really appreciate you taking your time out and really sharing your insight and your work with our community, and looking forward to continually working with you on the good work. And again, thank you again for joining us, and see you tomorrow for the Black Lives event. Thank you.
Thank you so much. Thank you for this opportunity. It was such a pleasure. Hoping to connect with you very soon. Thank you so much.
Thank you so much.